Hello and welcome to Science 5, which is the conversations in science. Today, we're talking about the COVID-19 vaccines with the chief scientist, Dr. Soumya Lopez. So, welcome, Miss Soumya, and have a great day. Please be seated. So, what's really good that so many vaccines are developed around the world. More than 31 of the of that have gone into the clinical phase of that testing. So as you can see, and also as you know that we go through the phase 1 and 2, 2 and 3 in clinical trials, and where are at least 8 candidates now which uh, are in the late stages of clinical testing. So what this means is that we will start seeing the results that from some of these clinical trials by the end of 2020 or early 2021, and we'll start getting an idea about how they're performing both in terms of safety and also in terms of their efficacy, that is their protective power after the clinical trials result are available. The regulations around the world, which is we'll have to look at the data and make a decisions in approving the various and the produce rather and need to produce and stop all over the world. So by uh, that the people actually start giving vaccine, hopefully that there be more than one or more two vaccines, hopefully. So there will be more them or one or two vaccines that turn out to be a good, it would be uh, shoulders in that middle of 2021. So Sonia, I have a lot of questions for you. So first is everyone's want to know when we can expect a safe and effective vaccines for COVID-19. So far, COVID vaccines with could see on what's very effective to protecting at least 70% of people that receive the vaccines, and the minimum standard that were set and 50%. So it must be safe both in the short term and the long terms. It should be safe in different age, children to pregnant women to the elderly. Ideally, it should be given in a single should provide immunity for as long as possible, certainly for several years, and it should be easy to store and distribute, which means that it should not require ultra cold storage facilities which are not available now. So, and before we get into vaccines, a little more could you please to describe to us what the ideal vaccines for COVID-19 would be like? So that's really important question. So because the public must be measured that the standards that have been set globally for licensing vaccines and drugs are going to be followed in this case. So as well as, and that this will be the new shortcut. So while we talk about speed and skills and what we can do to support that, so we talk about the minimum efficacy of vaccines, that safety profile passives that regulates would look at this must be fulfilled, and that development must be able to show the data both regulating agencies so and countries, so World Health Organizations, and as you know, we have a process code, pre-qualifications rules. We give a vaccines or doing uh, stamp of quality approval of these features we take into uh, consideration. So we also a scientific advising group of expert immunization stages that makes the policy guidelines or vaccines, and they are going to be looking at this data very carefully before they make recommendations on we vaccines which populations, you know what precautions as to you take it produce. So there is a lot of vaccine about its safety and efficacy. How will World Health Organizations and countries ensure that this vaccine is safety? So this is something that we've been discussing with the members of states, with countries. I think every government is thinking about is now people are thinking about, is this also an ethical about questions for people, and I think there's a sort of general agreements now that how risk of infections, you know. So we're in the frontliners workers and the healthcare worker really imputed by World Health Organizations in COVID-19. And so in most countries, I think that conserve is that they need to be protected. Those who are at the front lines also have to do their jobs in order to keep everybody else safe and also healthy. So Soumya, once vaccine is approved for mass development, how could World Health Organizations and health authorities decide who should be get these vaccines and why? So because we're going to have limited closes of vaccines initially to everyone, it cannot get it you to know on the day, or it's going to take a month, and yes, to have able to ramp up the to the billions of closes needed to protect. So you know 60 to 70% of the population. So next in a line would be those who are highly vulnerable, the elderly, so people who have pre-existing diseases, underlying conditions, so which put them at higher risk of mortality and of getting seriously ill with COVID-19. So those who would be the people to prioritize, and gradually one could expand into the across parts of the populations as well. So that's all the info that I have given to you, Miss Pin. Thank you. So once again, thank you, Miss Song, that you have it. World Health Organization Chief Scientist Dr. Soumya Lopez, so giving your the latest on vaccines or COVID-19 vaccines. Remember, as now information comes in World Health Organizations, will keep your updated through our websites and various social media channels. So stay tuned, stay safe, and still with science again. I am Christine Sabayog, your host for today.